Hello guys! So this will be our final integrative output for Physical Education 4.
You will learn about tent pitching,
lifting and carrying techniques,
bandaging techniques,
and how to be cool just like us.
So keep on watching to learn more.
Hello! In this part, I am going to set up a low-profile stealth tarp. To jump right into it, let's tie our ridgeline. You can use a nylon rope or a paracord. Tie an overhand loop at the edge of the rope, then wrap it around the tree. Create a U shape as a first loop to pass through the overhand loop. Use a stick to go beneath the first loop as a lock, then pull tightly. As you can do this on the other side of the rope, there is also one more knot you can try, the tensioning knot. As demonstrated earlier, just place it around the tree branch, then go over the line. Then wrap it around the other way. Repeat until it's tight enough. Tie a small looped hitch to end the loop. Next, make 3 small overhand knotted hoops and attach it to our ridge line using an adjustable prosaic knot. To do that, simply pass the loop over the ridge line with the tag and going through it, and repeat. Cinch it slowly so it doesn't slip. Since I am not using a tarp but a blanket, I am using safety pins to connect it with the prosaic knot. After that, secure the tent with the use of tent pegs. In my case, I improvised my tent pegs using wooden sticks I can find on my surroundings. Use rocks as well so that it can withstand the wind. This will also create the shape of our tent. And there you have it, our stealth tent. It is not the perfect setup, but it does the job.
In the circular bandaging technique, you must start with the lowest part of the body part that is injured and lock the bandaging with just 2 layers or less. Remember, do not make the bandaging too tight or too loose. Next, we need to roll the bandage upwards by curving the bandage upwardly on the rear side of the bandaging. And lastly, we lock the bandaging on the uppermost side of the injured body part after layering it again. In the spiral bandaging technique, we start by bandaging diagonally, layering it once horizontally, and folding the excess bandage from the primary diagonal formation. We can then lock at the lower end of the injury by adding another layer. The next step is to continue bandaging upwards on a diagonal fashion. This will make the spiral formation that the bandaging technique is known for. At the upper end of the injury, we can then lock it after layering the bandage.
Kindly ask them to support their injured arm or elbow using the other hand. Lightly glide the bandage below the arm while the tip of the triangle should be below the elbow. Place the top end of the bandage around the back of the neck like a collar. Get the other end of the bandage upright to overlap the forearm. Knot the two ends above their collarbone. Adjust the sling to fully hold its arm and for their comfort. Then twist the tip of the bandage and tuck it in. You can also use safety pin or tie it. Doing this additional step depends on you, but this is for checking the circulation of their fingertips. This is also helpful to determine if the sling placement does not interrupt the circulation. Press the nails for 5 seconds till it turns pale and observe if the nail color returns normally within 2 seconds.
Fireman's carry is an effective way to distribute someone's weight and allows you to carry them over long distances with minimal strain. Here is how it's done. Number 1. Raise the victim to a standing position. Number 2. Shift your weight to your left leg and stick it in between the victim's legs. Number 3. Grab the victim's right hand with your left hand. And number 4. Transport the victim.
Thank you guys for watching.
So we can build this dream together, standing strong forever. Nothing's gonna stop us now. If this world runs out of lovers, we'll still have each other. Nothing's gonna stop us. Nothing's gonna stop us now.